Hi, I'm Dr. Carl Larson with AidaCare Dental and Dentures. Today I'd like to talk about dental implants. This is a very popular subject with my patients, but it seems like there's a lot of confusion about what dental implants consist of and what they can do. At the most basic level, dental implants are replacements for lost natural teeth. Natural teeth can be described as having two parts: the root, the part below the gum line, and the crown, the part above the gum line. And dental implants also have a root part and a crown part. This part is the implant. The implant is the root and is usually composed of medical grade titanium. This material is very biocompatible, especially for bone. Your body likes it. Bone cells will actually attach to the surface of the implant, creating an extremely strong connection. Modern implants are basically shaped like a screw, and you may have heard them called that, but that's not really how they work. Implants do have threads that help increase surface area and give initial stability to the implant, but it's the attachment of the individual bone cells to the implant surface that really gives it strength. This cell attachment is called osseointegration or just integration. The process of integration takes several months. Bone cells work slowly, and implants need time to gain a solid connection with the bone before stress can be applied on the implant. That's why in many cases the implant will be left with just a small cover or cap after placement, and a final set of parts will be attached to the implant after several months. These parts are referred to as abutments, and they're what will connect the implant to the artificial tooth or teeth. This is the abutment. Some abutments are designed to have a ceramic crown fit on top of them, while others work together to support multiple replacement teeth. Often, multiple implants work together to support a ceramic bridge or an acrylic denture, and they have specialized abutments that allow them to work as a team. With the abutment in place, the final tooth or teeth can be connected. In this case, a single crown. A single crown on a dental implant can chew normally, it looks like a real tooth, and is maintained the same as a natural tooth with brushing, flossing, and periodic visits to a hygienist. There are also abutments that allow implants to work together to replace multiple missing teeth. These can even replace an entire arch of missing teeth. A full arch implant bridge is often referred to as an all-on-4 or an all-on-X, referring to all the teeth being supported by 4 or more implants. The main advantages of this option are chewing power and permanence. This option gives strong chewing ability, close to what a full healthy set of natural teeth can do. As far as permanence, that's more of a psychological benefit. This option is not removable at home. This means it feels less like a denture, but it does make it more difficult to clean under the prosthetic. This option is also by far the most expensive implant option and requires more bone removal than other options. In addition, to properly clean under the bridge, it may need to be removed periodically by a dentist. This is a complex procedure and more expensive than most other hygiene procedures. Another option to replace a full arch of missing teeth that utilizes the benefits of implants involves creating something that snaps onto the implant abutments rather than being permanently attached. This means that the prosthesis can be unsnapped by the patient at home. This option is called an overdenture or just implant denture. It may not give as much chewing power as the permanent implant bridge and does carry the psychological stigma of a denture, but it allows for much easier cleaning and is significantly cheaper than the permanently attached option. It should be noted that a skilled lab should be able to create a beautiful smile with either implant option. At our office, we're able to perform implant placement and final restoration all in one location in most cases. We pride ourselves in being able to give our patients all available options and thoroughly explaining the benefits and potential downsides of all options, including the option of no implants at all. As our name implies, we do a lot of dentures, and we're very good at making beautiful and functional conventional dentures. Implants can make the experience of having dentures much better, especially lower dentures. If you have or need dentures, ask us about the options of using implants to improve your chewing power and denture stability. Or if you prefer something that's not removable, ask us about doing an all-on-4 or all-on-X implant bridge. Implants are not without risks and drawbacks, however, and they can fail. Proper surgical and restorative work can reduce the risks, but other factors make it more likely that implants will fail either in the short term or long. The biggest risk factors are smoking or other sources of nicotine and diabetes. Both of these risk factors result in reduced blood flow to the bone around the implants. There are other risk factors as well, and you're welcome to contact me to discuss these. If you have any of these risk factors, it doesn't mean you can't get implants, but it does mean your implants have a higher chance of failing. Implant failure generally means that the implant becomes loose and has to be removed. A failed implant can sometimes be replaced, but in some cases a different solution will be needed. Despite the risk factors that need to be considered, implants have a high success rate and have a great impact on the quality of life for patients who get them. If you would like to learn more about implant options or find out if you would be a good candidate, please reach out to our office or message me directly. I hope you found this informative. Once again, my name is Dr. Carl Larson with AidaCare Dental and Dentures in Meridian. Have a great day.